Welcome to KACF's Giving Summit virtual series in the frontline of COVID-19 Roadmap to Recovery. We're honored to have Dr. Jim-Yong Kim as our speaker, and we're pleased to partner with the Korea Finance Society for this event. I'm Kyung Yoon, the president and co-founder of the Korean American Community Foundation. We began to host our virtual Giving Summit series as a way to be connected and to build community during this pandemic, and to learn how each of us can contribute to making a difference. We've heard from nonprofit leaders, healthcare professionals, and a journalist in the front line. As their work continues, the country and all of us are asking the question, what's next? How do we move forward? As we all know, COVID-19 is a health and economic crisis. Since the start of the pandemic, KACF has been working with our partners in the front lines to identify critical needs in our community. We immediately began to distribute funds to provide food and financial assistance to struggling low-income families. We also funded a Korean language COVID-19 health hotline. And as we look beyond the crisis and chart a path to recovery from this health and economic crisis, I could not think of a better person to hear from than Dr. Jim-Yong Kim, whose perspectives and expertise are squarely at the intersection of these critical issues. Now, before I turn it over to Dr. Kim, it's my pleasure to introduce our friend, Sandor Hao, Managing Director at Charles Bank and co-chair of the Korea Finance Society, to say a few words. Sandor?
Thanks, Kyung. It's great to partner with the Korean American Community Foundation. Thank you for your leadership in our community, for building a culture of giving back. Korea Finance Society is celebrating its 10th year now. We're a community of over 2,000 global Koreans in the New York tri-state area who work in finance and simply have the goal of helping each other out. Help comes in the form of summer internships, full-time jobs, and advice on advancing one's career. And our flagship program, our fellowship program, has helped over 120 college students get full-time jobs. And we encourage and demand that they give back to the community. So similar to KACF, our mission is to build a culture of giving back. So what better way to come together as a community today than to listen to one of our foremost leaders on the major topic of the day, COVID. Dr. Jim-Yong Kim is a vice chairman of Global Infrastructure Partners, was previously president of the World Bank in Dartmouth College, and is a co-founder of Partners in Health. And maybe it's just my small town upbringing, but I've always thought it was just as impressive that he was a high school quarterback and point guard. And even though he is a world figure, his heart has always been with the Korean American community and has been an incredible role model to countless folks, including myself. He'll talk about, as Kyung mentioned, his plan of managing and hopefully defeating COVID and how we can work together as a country to restore the economy. Never has there been a more important time where we need leadership who understands healthcare and business, and it helps that he's a great quarterback too. So thank you, Dr. Kim. The Zoom floor is yours.
Thanks very much, Sandor. Hold on, let's see. Okay. Thank you very much, Sandor. And Kyung, thanks for having me. And I just, as always, when I do something for KACF, I can't forget to urge everyone to be very generous in donating to KACF. You know, one of the things that we've learned about this virus is that it goes after the weakest. It goes after the poorest. It goes after communities of color. And so I know that KACF has been doing a lot to support people going through a very difficult time during the COVID outbreak. And so please be generous and please continue to support KACF. You know, I thought what I'd do, I've been doing a lot of this lately, and I had kind of sworn that I wouldn't become one of the talking heads out there. And I've kind of been pulled into it because the response, especially in the United States, has just been so bad. And so I jumped into it probably about 10 weeks ago when I found myself incredulous that the United States public health community had given up on actually going after the virus at a point when there were many states that had no cases. So let me try to give you my sort of old infectious disease doctor view of what this virus is all about, what it means for the economy. You know, this is about my fifth or sixth pandemic, and so my early career was devoted to trying to tackle pandemics, but specifically tackle them in developing countries. And so the first one was drug-resistant tuberculosis, which was an ignored problem. And most of my work was fighting against the global public health community that had decided, well, you know, it's too complicated, it's too difficult, you can't do anything about it in developing countries. We thought that was absolutely the wrong way of thinking about it. And we actually succeeded in changing World Health Organization policy. And it helped a lot that the head of the tuberculosis department during the years when we made the most important changes was Dr. Jong-wook Lee, Lee Jong-wook. And Dr. Lee then went on to become the Director General of the World Health Organization. And I actually helped to manage his campaign. We were two of the very, very few Korean-born people in the global health world. And so we got to be very close quickly. And when he won the election, it was in January of 2003, which was toward the end of the SARS outbreak. He asked me to come to Geneva to work with him. And I went, and my job in those first few months of transition, my job was to work with the team that was managing the end stages of SARS. So the people now, Mike Bryan is the guy who is the top person in Geneva in managing the response to SARS. Mike became a very good friend, and I have now worked with Mike quite a bit. So I started calling, you know, my friends, Mike Bryan and others. I was just saying, what's going on here? And they all told me, you know, the West is just not taking this seriously enough. You know, European countries, the United States just aren't ready. This thing is nasty. You know, we really have to be careful about it. And so I thought, well, what's going on here? Well, you know, surely we understand the severity of the outbreak in China, then in Korea, other parts of the world. Surely we're responding, and we just weren't. And you know, I don't have to go into great detail about the failings of the U.S. and the European response. I will if you ask me about them, but it's probably something you're tired of hearing about. It's on the news all the time. So why is this virus so particularly nasty? You know, one of the things that was very made a big impression on me was I called the Korean CDC and talked to some of the top people there about, you know, what their response was. And by this time they were having some success. This was probably the second week of March. And they said, this is a nasty virus. This is one of the nastiest viruses we've ever dealt with. It hides out, it transmits even when people aren't having symptoms. It's something that you have to aggressively go after. And so the Koreans did just that. But here's why I think it's so nasty. First of all, the best study on when it transmits really came out recently in a journal article from Taiwan. And Taiwan's probably had one of the most successful responses to the virus. And they studied every single one of the first 100 patients. And they asked the question, when did these people infect the ones around them? And so it turns out that the peak time of infectiousness was right when symptoms started showing. But they infected people 4 days before symptoms started showing and 4 days afterwards. After the 5th day, they had nobody who was infected the 5th day after the patient, the COVID positive case was showing symptoms. And so when you have 4 days prior to showing any symptoms that you're infectious, it makes it very difficult to stop. Now, in contrast, SARS had a much higher death rate. You know, we don't know exactly what the death rate for COVID-19 is, but we know that it kills people effectively enough so that it can bring some of the best healthcare systems in the world, Spain and Italy. It can bring an OECD advanced economy healthcare system to its knees. We know that. It didn't happen in New York, partly because we prepared early enough and the social distancing measures seem to have been effective enough. But what we know is if left unchecked, it can bring very sophisticated healthcare systems to its knees. And so that's how lethal it is. It's probably in the 1 to 1.5, maybe up to 2% range. And it could be lower, it could be 0.6 to 0.8. But just to give you a comparison, the seasonal flu kills about 0.1 to 0.2%. So it's anywhere from 5 times more deadly to as much as 20 times more deadly than seasonal flu. So it's much deadlier than seasonal flu. It transmits very nicely. It transmits in the sneakiest way. And the virus has seemed pretty steady. Now, the crazy thing about the virus is that it seems to have acted very consistently across the world where it's been. And so we know that there have been places where they've been very effective at stopping the virus. And so probably the most important study was done of some 50,000 cases in Wuhan. And now somebody who's become a good friend of mine, she's a professor at Harvard School of Public Health. She, along with her colleagues from Wuhan, have probably done the best study of the dynamics of the disease in Wuhan. What they showed was that at first, without any measures at all, the virus was replicating very quickly. Every infected individual would infect about 3 to 4 other individuals. 3.88 was the number that they found. That means you have a very rapid rise in the number of cases. When they put in measures to lock the city down, and these were extremely strict measures. Not only did people have to stay in their homes, but there could be no cars on the street. So it wasn't like what we are doing now where anyone can go to the grocery store. It was much more strict than that. What happened was it went from about between 3 and 4, and it dropped pretty quickly to around 1, but still above 1, around 1.25. Now, it's not clear exactly which intervention led to the dropping of the curve, but then when they started doing broad testing anyone who had symptoms, even testing asymptomatics, when they started doing contact tracing, meaning is a positive person able to prevent other people in that person's household from getting infected. And often in Wuhan, people were living in very tight quarters. So what they did was something called central quarantining, meaning if you were found to be positive, you were immediately taken out of your home and put into either a dormitory or a hotel where you stayed until the disease was either resolved at some point where you started testing negative over time, or if you got sick, then you would go to the hospital. But the very important part of what their response was is they didn't put everyone who was a little bit sick into the hospitals. They had very specific places to put diagnosed positive cases. But also they did centralized quarantine. Isolation is the term we use for people who are already sick with the disease. Quarantine is the term we use for people who we suspect might have the disease. Even those who were quarantined often were taken out of the home and put in special quarters. Now, people say, well, you can't do that in the United States. That's too draconian. In Hong Kong, in Korea, some form of that was done. And it wasn't done because they wanted to be authoritarian. It was done because they wanted to stop transmission. To stop transmission, you've got to separate the people who are positive from their close contacts. And so when they had the social distancing, when they had broad testing, when they had the contact tracing to see everyone that person was in contact with, and then when they had the effective program of isolation and quarantine, the cases dropped. And the reproductive number, which was 3 or 4, in other words, one case led to 3 or 4, then dropped to around 1, but still, the epidemic was going on forward. It dropped once they put all those measures together. What they say in Wuhan is that the social distancing was extremely effective in stopping transmission between households. But then what happened was 75 to 80% of the cases were coming from household contacts. So once they started separating the people from their households to prevent the transmission, that's when the rate dropped very suddenly. Now, some form of this is being done in every single country that's been successful. So not everyone has been able to lock all the streets down. But if you look at Spain right now, Spain is in a very interesting situation that I can talk about, but Spain right now is in their easing up phase. And their easing up phase means that everyone is still in their homes, but that children who were forbidden from going out in the streets at all before this now can go out on the streets for 1 hour between 7 a.m. and 7 p.m. Right? I'm in Westchester County, and there are people everywhere on the street. So we're nowhere close to being where Spain is in their easing up of lockdown in our current state of lockdown. So New Zealand, Australia, Korea, all have been able to do very, very well because they didn't just do the lockdown. They started going on offense, chasing down the virus. Every single case that happens, they do complete contact tracing. They find everyone who is either ill with the disease, has been shown to be COVID positive, or is suspected to be COVID positive. They separate them effectively, sometimes in their homes, but they find a way to separate them so that they don't continue to transmit. And more importantly, the whole national program is well coordinated. Now, let me just talk a second about Korea, and then we'll try to get to questions. Right? So Korea has been incredibly effective in their response. You've probably all heard of the single case that's now led to over 100 new cases. Well, part of it is that they made an incredibly bold move by letting the nightclubs open up again. If you ask me, I probably wouldn't have done that. I probably wouldn't have gone so quickly to opening up the nightclubs. But think about their task in terms of contact tracing. They've got the Korean Army out there now helping with the contact tracing. One person probably exposed in some way thousands of people. Now let's see what happens. My sense is that they're going to get on top of this. Of all the crazy media things I've been asked to do, yesterday I did an interview for the show I've never seen it, Real Sports with Bryant Gumbel, something like that. And I was asked to comment on how Korea got to the point of having their baseball league open, whereas the United States is so far from being able to do that. And so Korea got there mostly because they were scared to death in 2015 when they completely bungled the response to the Middle East respiratory syndrome. The things that they did were just unthinkable now in Korea. A person came back from the Middle East, had been infected with MERS. And MERS is also a coronavirus, but has a mortality rate between 20 and 30%. So it's a scary disease. It doesn't transmit anywhere near as well as COVID-19. But what happened was this person came back, and that person sick with MERS was transported to another hospital, and that hospital wasn't informed that a MERS patient was coming. A physician at that hospital was exposed to the patient, later developed the disease, and went to an event with 1,500 people. So the Korean people were just furious about the lack of transparency and the bungling of it, and so they changed the laws. When an epidemic happens in Korea now, the government has access to credit card data, has access to your movement information, a lot more access. They can be much more invasive than before. And the other thing that they did, which was really important, was they were completely transparent. They had amazing, wonderful press conferences every day explaining to the people in Korea what they were doing. And so they got it under control. But what we've learned from Korea is that no matter how good your control is, you're always at risk for another outbreak. And so this happened. I think they're going to get it under control. I hope they get it under control. And when they do, they'll again go back to maybe gradually opening up the bars and nightclubs. I actually think that it's a congregate setting that is just very difficult to keep social distancing. But because they were so aggressive about it, they got it under control. Same thing with New Zealand, same thing with Hong Kong, same thing with Australia, same thing with Greece, with the Czech Republic. The countries that have implemented the full public health response have gotten it under control. Now, some of the media and some of the writing I've been doing has been related to this opening up, right? And they keep saying, aren't we being forced to choose between the economy and public health? And you public health people, I had somebody tell me, you public health people, Oprah Winfrey in 1987 said 20% of the people in the United States were going to die of HIV. Never happened. I can't trust any of you public health people anymore. Well, I immediately said, look, I cannot take responsibility for what Oprah Winfrey said about public health 33 years ago, however long it was. But that's the kind of stuff I'm hearing. And what people are saying is, surely we've done enough so that we can now reopen the economy. Well, I think what we're going to see is either the virus will continue to behave as it's behaved everywhere in the world so far, or it will behave completely differently in the United States. And that's essentially what the folks who are insisting that we open up are assuming, that somehow we'll be different, that somehow we'll be exceptional. We'll see. We'll see what happens. And boy, nobody hopes that the virus will behave differently as much as I do. I really hope it'll behave differently, but there's no evidence that it will. And so people are saying, yeah, but there could be a second wave. What do you think? Is there going to be a second wave? I just say there already have been second waves, not as big as before, because in the countries like China, like Korea that have opened up, Singapore had a second wave. We have seen them everywhere because this virus is now, in terms of the way it infects others, has become fairly predictable. If you loosen constraints, if you don't use masks, if you don't keep 6 feet away, if you don't keep people mostly at home, it's going to spread. And so what I've been doing in watching how quickly the public health community gave up in the United States, I couldn't believe it. And it was very similar to the work that we were doing in it with drug-resistant TB. We were saying, no, you got to treat these people. They're spreading it to their family members. People are dying. You've got to treat this. And they're saying, no, it's too hard. It's too complicated. Can't do it. Same thing when I went to the World Health Organization. I started really pushing for HIV treatment in Africa, and the public health community said exactly the same thing from TB. Too complicated, too expensive, can't do it, impossible. At that point, I said, if we let 25 million people in Africa die, even though we have medicines, and by 2003, when I was working in WHO with J.W. Lee, it was 1 pill in the morning, 1 pill in the evening, and it cost about $70 a year for HIV treatment. That's what we were able to do. I said at the time, if we don't treat Africans for HIV, we will forever be remembered as the generation that allowed 25 million people to die of HIV because it was inconvenient for us. So that's what happened here. Everyone gave up. Everyone said you can't do contact tracing, you can't do just all you can do is mitigation. All you can do is lock it down. And so I started calling governors, and I actually couldn't get governors on the phone, even people I knew, because they were too busy trying to respond to COVID. But I finally reached Charlie Baker, the governor of Massachusetts, and Charlie was an old friend of mine. And I said to him, Charlie, the best data we have from China, from Korea, from everywhere, is that you cannot stop this virus just with social distancing. You've got to put into place the entire public health response. And it's the difference between sitting at home and waiting to see what the virus will do to us versus going out and going after the virus aggressively. Every country that had been effective, that's how they talked about it. You got to go after the virus. You have to go on offense. You have to chase it down. You have to stop it from spreading. And so Massachusetts had one of the first outbreaks in the United States at a conference. And there are a lot of cases, over 1,000 cases a day. And so what I said to him was, it's going to be really hard. We're going to have to hire lots of contact tracers. But we've done this before. Partners in Health, the organization I've started, we did contact tracing in Liberia during Ebola with mostly illiterate community health workers. So the thing that we brought to the table was the spirit of not giving up and the spirit of saying, okay, it's hard, it's complicated, it's going to take a lot, but you got no choice. The evidence is overwhelming that this is the only way to actually stop the virus. So luckily, Charlie agreed to it. And it was interesting, the minute we announced that there was contact tracing going to happen in Massachusetts, we started getting calls from everyone. Before Charlie made the announcement, I had to tell him, I said, Charlie, just understand that when we make this announcement, you might be criticized, you might be ridiculed. There'll be people who are saying you're crazy, it's not possible. And he said, I'm ready for that. I get that, I can handle it. And so I think what happened was that people just kind of came to their senses and said, well, of course we have to do contact tracing. Now, I think you hear a lot about contact tracing, but we were really the first ones who said, no matter how big your epidemic is, you've got to do contact tracing. So we're about 6 weeks into it. It's not easy. We hired 1,000 contact tracers. We had 40,000 applications for those 1,000 positions. Every day we have new obstacles. Every day we have new solutions for those obstacles. And we're beginning to feel like finally we're going after the virus. We're getting closer and closer, because it's the simple things that you've got to fix. You've got to make sure that as soon as the test is positive, someone's on the phone with them within hours to try to understand where they've been. Luckily now, because there's so much social distancing going on, the number of close contacts is only 2 or 3. This is the time to do this. The time to do the contact tracing is when people are still observing social distancing. In Georgia, it's going to be so hard because people are going to be exposed to so many different people, and so I've been now reluctantly going out and into the media, because it's absolutely crazy that now there's consensus in the public health community that you've got to do testing and contact tracing. And most things you read now, people will admit that you need to do testing and contact tracing. But the way they're thinking about it is, if we want to get out of the lockdown, we have to do testing and contact tracing. But that's not the only piece of it. If you want that curve to not be flat, but to go down, you have to do testing and contact tracing. You've got to start as soon as possible. So let me just end and take questions now. But I hope the wishful thinking, maybe even the magical thinking of folks who are saying we've had enough. The treatment is worse. I mean, the cure is worse than the disease. We've just got to open up. From my perspective, what I'm seeing. Did something happen? I think I froze. Am I okay still? Okay,
Yeah.
let me keep it. From my perspective, here's what I see. What I see is that the opening up is going to cause outbreaks. This is what Tony Fauci said. Tony actually is a very good friend of mine. We've worked on all of these 5 outbreaks together, and I think there's no question that he's, again, unless something miraculous happens and the virus acts differently. If it acts the way it has, we're going to have outbreaks. And it's just going to make the job of testing and contact tracing that much harder. But you know what? So what? I mean, we have no choice. And I think, I don't know how many dips, it sure doesn't look like a V-shaped economic recovery to me. It looks like a W shape at best. And the only thing I worry about is how long will it take for us to stop adding W's to the recovery. There's a way to do it. It's been shown. This is going to be the most difficult project I've ever taken on. It's going to require hundreds of thousands of contact tracers. We're going to have consortia of governors coming together to do it. But the good news is that there are a lot of enlightened governors who are anxious to move in the direction. So now, in addition to Massachusetts, I'm working with Ohio, with Illinois, with North Carolina, with Delaware, with the city of Newark. And over time, I think we'll see that these systems that Korea has in place to be able to respond quickly, that's just going to be the reality of our lives going forward. This is not something that'll go away anytime soon. But also, my great hope is that that even if it does go away, in a year, in 2 years, whenever it does go away, I hope that we'll never, ever again forget that a virus can bring down the global economy. Right? So the one thing that I would leave you with is, I've been working along with partners now very closely with Senator Andy Levin of Michigan and Elizabeth Warren of Massachusetts, and then a lot of the Democratic caucus, to, for the first time, put together a bill to support these testing, tracing, and isolation protocols. And it's for $75 billion, which is still way too low, but it's a great start. And let's see what happens. Already we're starting to see that this bill is becoming partisan. But to me, it is the surest sign of just how mad we have become, how crazy we have become in this country, we're using, the language that you hear. We're using bazookas in with fiscal and monetary policy. Everyone's talking about going negative on interest rates. 2 trillion, 2.5 trillion of stimulus so far. And why, in a context where this profound socioeconomic crisis is in fact simply the result of a public health crisis? Why would you do so much to treat the symptoms and never get at the core of the problem? There's no money. What I say to people is, fiscal and monetary policy, we're using bazookas, and in public health, we're using squirt guns. It makes no sense. We're finally moving to support states in putting these responses together, which, by the way, we'll need anyway, especially if, starting in October, we have a new version of COVID coming around. It makes no sense that we're not supporting the public health world, and we are simply treating the very downstream symptoms of this problem. I don't know when we'll wake up. My father used to tell me all the time. He said, Jim, how many times do you have to put your hand in the fire to know it's hot? That's really what we're looking at. We're looking at a situation where I think we're going to have to put our hand in the fire a few more times before we know it's hot, and before we, understand that this is really what we need to do. If there are other questions, herd immunity. I'm sure you've all heard that. It's a very popular idea. The one place that kind of has tried herd immunity in Sweden, they're now under a huge amount of critique because the death rate is 3 to 4 times that of neighboring countries, and the economic performance is identical. So it didn't help with the economic performance, and unfortunately, the death rate has been extremely high. Oh, and moreover, they've probably not reached anywhere near herd immunity. In Spain, where so many people were infected, where the outbreak was so huge, they finally did a surveillance study, and they were hoping that 15–20% of Spaniards would have antibodies for COVID, and they found out that it was less than 5%. And so 95% of the population in Spain, despite all of their interventions, is still susceptible. So if they loosen up too much, that 95% could get infected again. All this to say, look, this is the big one. This is the one that all of us infectious disease doctors always warned the world about, but never quite, even in my own mind, I never could quite believe that this could happen at this scale, but it has. And the only way down the mountain, Mike Ryan, my buddy at WHO, said about 6 weeks ago to the members of WHO, for those of you who don't have many cases, the only way to stop from having a mountain of cases is to do social distancing, testing, tracing, isolation and quarantine, and of course, treat the people who are sick. And he said, and for those of you who are sitting on a mountain of cases, the way down that mountain is exactly the same. You've got to do that no matter how many cases you've got. So I'm hoping we wake up. I'm hoping we do that. I'm hoping we do it sooner rather than later. Every day that we delay, every day that we open up when we shouldn't be, makes the task harder. But I find hope in the frankly heroism of the healthcare workers and the courage and vision of many of the governors that I'm working with. Let me stop there and then open it up for questions. Maybe I haven't been watching the chat, so maybe there's some questions already. But after that, happy to take questions.
Thank you so much, Dr. Kim, for your powerful and urgent message. And yes, everyone, if you have questions, please use the chat box and submit your questions. But we already have some that have come in. And I will say one question from Anika Kim is, what are your thoughts on the new normal after this pandemic? I don't know when after will be, but how do you envision changes in the public health world, but also in our society?
Well, I think that there's no question that public health is just going to be part of our lives. I'm old enough to remember going to the airport and just walking up to the gate and getting on the plane. After 9/11, the security measures took on a totally different feel and level of complexity. I think that we always knew this was possible, and we always warned people that it was possible. But now that we know that it's possible, I don't think that you're going to be able to go back to a situation where everyone will forget about this. I don't think they will. And so, I'm in the infrastructure business now, and I spent a good part of the morning trying to think about how to open up airports. Well, what's that going to look like? You're going to see, I think, more countries put in 14-day quarantines. Certainly, countries in Asia have that in place. We were thinking about things like, could you pre-quarantine? What would that look like? Could you pre-quarantine at home? What would be it's like the chain of sterility in surgery? How could you really be sure that in a 14-day period somewhere else, you had no exposure to COVID, and that when you go through the airport and get on the plane and get to the other country, that you can be certified somehow? I mean, these are all the things that we're going to have to think about. The conversation with the HBO guys about baseball, I said, I think it's fine. Some people say it's immoral. Major League Baseball shouldn't even be thinking about playing. Well, I think it's going to be extremely hard for them to figure out how to play baseball games in Georgia when cases are shooting through the roof. I think that'll be very difficult. But I think every single business is going to have to get very creative in thinking about, how to create the new normal. The things that I really worry about are restaurants. I just don't know how, we're going to be able to get back. If you're saying that restaurants can only have 40% of the customers, they were barely making it before that. Is it going to be possible for them to come back? I don't know. I think it might, the restaurant business might take on a different form. But, what I'm telling everybody is, even if this somehow goes away, remember what happened with this virus, and remember that this could come back with a few mutations that make it so that the people who've been exposed before are no longer immune, and that the vaccine that we've provided is no longer effective. This now has to be part of our everyday life. And what we've learned from Korea and China is that it's disruptive, but you can get on top of the virus. You can get it under control. We've learned that from Australia. We learned that from New Zealand. You can do it. And so having these systems ready to go are going to be the most important, I think, result of all of this. But also, I think you're going to have to think, what we see in China now is that the supply side is doing very well in terms of getting services available, but demand is still, lagging behind. And, if you look at the travel industry, boy, it's hard to imagine when people are going to feel completely comfortable getting on a plane, let alone, having to go somewhere and quarantine for 14 days.
So when you speak about people feeling comfortable, I mean, what we're all hearing is that it won't be until we have a vaccine. And just, we have a question from Michael Lee. What is your view on the timeline for COVID-19 vaccine development?
Well, so the fastest, there was a SARS vaccine, and we got it a few months after the SARS epidemic had burned out. So we know that there have been coronavirus vaccines in the past, but the task is going to be to basically vaccinate everybody in the world. So the thing that vaccine makers worry about now, I mean, so Bill Gates has been very involved in this, and Bill talks about, are there going to be enough glass vials? See, vaccines are going to be inherently difficult because you have to have a vial, you have to put liquid in the vial, and then you have to take the liquid out of the vial and get it into the person. That's really hard. In being involved with smallpox eradication, in polio eradication, there are going to be lots and lots of people who don't want anyone to shoot anything in them. This has been a problem in northern Nigeria for the polio eradication effort, and so reaching everyone in the world is going to be very, very difficult. Now, probably the good news is that once you reach a large majority of people in the world, that there's going to be enough global herd immunity so these outbreaks won't be quite as devastating. But it's not assured that there'll be a vaccine. I keep pointing to the SARS example, from an optimistic perspective, but we've had HIV now with us almost 40 years, and there's still not a vaccine for HIV.
So
I'm sure I'm just depressing everybody. All my colleagues tell me, would you just stop because you're just depressing us? But now my colleagues, at Global Infrastructure Partners are used to this, and because I've been right about the severity, going back about 10 weeks, I'm beginning to build up some credibility with my own partners. But I'm not saying anything that's any different from what WHO says every day about this, about the pandemic.
No, and we really appreciate your being candid and data-based with us. And I think we're just, there's just so many questions. One from Michael Chung. There have been reports of COVID survivors who are antibody positive as much as 8 weeks out testing, again, testing positive for the virus. So what is the latest that you're hearing on whether antibodies actually mean immunity?
Yeah, I think that, I think he probably meant antibody negative, because we've seen that. We've seen that some people who have diagnosed confirmed COVID disease, at some point after they've recovered, that they actually have very low or even undetectable antibody titers. So we can't say for sure that someone who's had COVID, actively been sick with COVID, is going to have antibodies. We don't know that for sure. But will we try, for example, getting llamas, the pack animals from Peru? They're apparently they produce a kind of antibody that's extremely useful. Is there a way of doing that? I think let's look at every single possibility. Nobody would be happier than me that if there was a kind of miracle cure. But the tricky thing about this COVID is we don't know for sure. A measles vaccine, the reason why it's so tragic when we have measles outbreaks is because it's so good and it confers very strong immunity. But for COVID, we're not sure what kind of immunity that we're going to get even if we have a vaccine. So yeah, that's one of the things we don't know. And again, because we don't know that, this is why I've been saying so strongly, okay, folks, let's have a little humility in the face of this awesome, terrifying virus. And let's, like they have in the places that have been successful, have humility, have respect, and then go after it in the ways that have been proven to be successful. So far, there's not a drug, the drugs, are not, remdesivir, I'm so glad that we have it. But, as far as I can tell, it's done things like, reduced hospital stays from 15 days to 11 days. That's great, but that doesn't change the way we have to go after the virus. It's not enough of a cure so that we can say, oh, it's fine, everyone get infected, even better, because we know that this medicine is effective. Medicines to cure or to have a huge impact on viral illnesses have been pretty rare, overall. One of the great success stories is HIV, of course, but that took 16 years to get effective antiretroviral treatment.
Thank you. We have a question from Jean Yun saying, if I and my family have recovered from COVID, do we still need to practice social distancing? Can we hang out with other people who have recovered as well?
Yeah, let me say that I'm sure people actually do that. I'm sure that they do. I think the safest thing for the population and for the world, because we don't know yet what it means that you've had COVID. We don't know what your antibody levels are. And even if you have high antibody levels, we don't know what that means for reinfection. We don't know what that means for being immune. Now, the overwhelmingly likely answer is yes, you can do that. That's likely what we'll learn eventually. If I had to bet on it right now, I'd say, yeah, it's probably safe. But the best I can do is tell you that we don't know yet. We don't know if it's safe yet. I can't hear you.
Yes, we have a couple of very practical questions from young people, I think, who are about to go to college or in college, or their parents, and they are asking, what do you think this is going to look like in the fall? I think as they're preparing to put down their deposits.
So I know that there's a tremendous amount of creativity. So I'm on the board at my alma mater at Brown University, and Chris Paxson, she did a very nice New York Times editorial on what she's thinking about opening up again. And you know, I started talking with her early on about this testing and tracing, and so she said that what they're going to try to do is something called test, trace, and separate. And so the idea is to have a very high level of testing, to still do as much social distancing as they can, and then somehow find a way of breaking up, you know, breaking up the time on campus so that there are few enough people to be able to maintain some level of social distancing. I think that they're also looking at all the different apps, the proximity apps, you know, the how we feel apps. You know, there are apps that have shown that if you trace how everyone's feeling on any given day, and you see that there's a cluster of people, you know, who aren't feeling well. You know, the crazy thing about smell and taste. You know, there's one preliminary study that suggests that in the pre-symptomatic period, the thing that correlates most with actually having COVID seems to be loss of smell and taste. Now, not everyone has loss of smell and taste, but among all the other things that you can look for, that's pretty. It suggests that that's pretty useful. Don't take my word on that. That this research is still going on, but this is the kind of stuff we're looking at. So I think the universities are going to have to be extremely creative, and I think students are going to have to behave differently. You know, again, the nightclub example in Korea says that I think we have to be very careful about any large congregate settings, and so if there can be a deal where you give up some of your you know, sort of privacy, that might be what we see. That you'd strike a deal with whatever institution you're going to be a part of, where you give up a bit of your privacy. You let, and you know, this all has to be negotiated, but you let you know, you let yourself be tracked, not by school authorities, but by everybody else. And you know, you really try to maintain social distance. These Bluetooth-based proximity apps are very interesting. It'll tell you how close you were to somebody and how long you were exposed to that person. And it seems like within 6 feet for 15 minutes is the amount of time that most people are using to describe someone as a close contact. You know, China, the way they do it is everybody on their smartphone has a little app, and it's either red, yellow, or green. And so if you're green, you can move. If you're yellow, quarantine for 14 days. If you're red, you have to quarantine until the doctor says you can stop quarantine, isolate until the doctor says you can stop isolating. But the way that works is if you walked into a building that was all green when you walked in, and you go out, and then later, a day later, they find somebody went red in that building, then you're now automatically yellow and you have to quarantine for 14 days, right? So that, you know, that system for the general population in the United States, I don't think would work. Will it work in a university setting? I'm not sure. I know that universities across the United States are trying to figure this out and going crazy looking at all the different possibilities.
It seems like that is the big question too, in terms of the contact tracing protocol. What has worked in other countries, in Asia, for example. You mentioned some of the states that have already incorporated some, you know, these protocols, Massachusetts being one, but many others. What do you think it will take for a state like New York or New Jersey to get on track for that?
Well, you know, the good news is both New York and New Jersey have expressed, you know, a commitment to doing it, right? But it's not, I think this is why we're working with so many states. It's not something that you just say, let's do it, and it kicks in. It's hard. You're going to have to, they're going to have to hire a lot of people. So we're sharing our training manuals, we're sharing our experience, we're creating these communities of practice where we're helping other states with all the lessons that we've learned. But I mean, you know, just as a simple issue, how do you hire new contact tracers and make sure that you stay compliant with the so-called HIPAA laws, the privacy laws, in terms of health information, right? So we figured that out in Massachusetts, and we think we can help others figure it out more quickly than we did. But it's not straightforward. But it's our future. I mean, we're just going to have to figure these things out everywhere, or else this will keep happening to us, right? And so, you know, again, gee, I hope I'm wrong, but watch this space. You know, Germany already seeing some spikes in cases everywhere where they've loosened restrictions. you have spikes in cases. There's not a single place where they've just let everyone loose and there was no consequences. If you have the testing capability to know what the implications of your, loosening restrictions are, there's just been no place that has been free of it. There are places where there are very few cases now, and probably wasn't the greatest idea to lock down in places where the cases were so few. We probably could have done it differently. But for the places where there are a lot of cases, including Georgia, I'm very worried.
So you mentioned at the outset, the observation that this virus has disproportionately impacted the vulnerable, the marginalized, and communities of color. We have questions from Terry Kim, Jeannie Park, Steve Peck, asking what, in your view, are the most important systemic changes we need to make in our society so that next time these communities don't suffer so disproportionately?
Well, there are some major cities, Chicago, for example, at one point, I don't know what the number is today, but Chicago at one point, 70% of all the deaths in Chicago were in the African-American community, and Chicago is not 70% African-American. So many, African-Americans have a much higher proportion of people who cannot work from home than white Americans, for example. The overall death rate for African-Americans is about 2.5 times that for white Americans. There's a lot of different issues. One is the jobs that they're in, but the other is that the number of African Americans who have underlying medical conditions, hypertension, diabetes, et cetera, are much higher. And so I think the conversation about universal health care of some sort, I'm not sure what the plan can be, but making sure that everyone has access to healthcare. One of the things we're running into in Massachusetts is that there are, whereas every single health center should just test a suspected contact immediately with no questions, we have to go through all of this rigmarole about who's paying for what. And Massachusetts is one of the best states in the country. We had Obamacare before Obamacare. There was Romney Care. And so it's one of the best states in the country in terms of having an integrated payer system. But still, we had to work through that. And we're still working through where to send a patient for a test where they will agree to do it, even if that person is not insured through one of their streams. This is kind of crazy. I unfortunately don't think we'll get to that question right away, but we have to get to it. Clearly, the fact that all testing was free and that even procedures that were done related to COVID were reimbursed later in Korea. Korea does have a national health system. That all made a big difference.
Thank you. And I think we only have time for maybe one more question. And we've had a number around the theme of the impact on the economy. What will the economic situation look like, in your view, in the next couple of years? And how should we prepare for it? And then, something that I think a lot of us are hearing, that tension. Is there a point where the collateral damage of a poor economy is equal to or greater than the effects of the virus?
Yeah. So I think we're already there. I think we're already there where the impact of a poor economy is extremely severe, which is why everyone wants to stop the lockdown. But again, it's a choice between what you think is going to happen, right? So if you really, really believe that opening things up, despite all the evidence from everywhere else in the world, is going to lead to a different outcome, then then you will choose the path of just opening up. But if you have some respect for the science, for what we've already seen, for the secondary outbreaks we're watching right in front of us, if you have any respect for that, then the right answer is to say, okay, we're not saying stay locked down forever, right? And if someone asks me, well, so then how long do we have to stay locked down? I think, again, if you look at the evidence, the minute we get these very effective public health systems in place where we can chase down every transmission, The minute we have those in place and we're confident, you're going to see two things. You're going to see the cases dropping, and in about 2 months, which is about how long it took in Wuhan, in about 2 months, you'll be ready to open up the economy. Now, you'll never be able to lose your vigilance. You'll have to stay hyper vigilant, but that's the only way so far that people have done this. And I've heard very important, powerful people say that we're going to have a vaccine by July. I just don't see any evidence for that. And even if there is a candidate that looks promising by July, getting billions of doses made is just not going to happen in that short a period of time. So that's 2 months from now, right? And so we've got something happening in Congress right now that I just wish everybody would pay attention to, which is that the Democrats, I think they're going to vote tomorrow in the House, have put together the first bill to support these efforts. And this is really important. And then we're going to see what happens when it goes to the Senate. $75 billion. So everybody, please call your member of Congress. And I had the great what's the right word? Great good fortune and thrill of being able to talk to the only Korean American representative, Andy Kim. He is on the select committee for COVID response. It's a bipartisan committee. And so I had a long talk with him, and he's been one of the strong sponsors of this bill. Let's watch. If it's voted down in the Senate, I think that we'll be able to point to that moment as one of the most tragic suicidal moments in the history of this virus. We need we need to do whatever it takes to put the public health system in place. Public health is going to be part of every one of your lives. Please encourage your members, call them, and especially encourage your senators to support this bill going through.
Well, thank you, Dr. Kim. I'm afraid we're out of time. We so appreciate you sharing your timely insights. And we also want to thank the Korea Finance Society for your partnership in today's event. And thanks to everyone for joining us today. So as Dr. Kim mentioned, all of us are grappling with the impact of the COVID pandemic, but this health and economic crisis has hit vulnerable, low-income families particularly hard. And so through the KACF COVID-19 Community Action Fund, we are supporting nonprofits that are providing critical services to help Korean and Asian immigrant families. And we hope that you'll consider supporting this COVID-19 Community Action Fund. Thank you again for joining us. Everyone, be well and stay safe.